Let us begin with how these three systems observed the illness, starting with Ayurveda. Ayurveda has been aware of the illness for about 3000 years now. Remember, this was a time before biochemistry. There was no blood test or urine test like we have today. They had to find it out in an indirect way. People peed on the ground back then, and it was observed that the spot where certain people with excessive urination peed would attract ants and flies. They proposed that it may be because their urine is sweet, so they actually tasted the urine of such people and confirmed the urine was indeed sweet. Many years later, when homeopathy was made up in the late 1700s, its conceiver Hahnemann had knowledge of the existence of diabetes handed to him by what was called allopathy, which was the then European traditional medicine of which he was once a student and practitioner. Once again, there was no clinical test available to analyze for sugar in the urine when homeopathy was invented. Hahnemann would have had to enlist the services of dedicated urine analysts whose job was to grade urine samples against a chart called the urine wheel by indulging in a process called uroscopy. Their task included classifying urine based on its sight, smell, and taste. If the pee sample they swished in their mouths tasted sweet to the tongue, they would identify it as diabetes. Hi, this is Aditya Menon from the Lateral Inquirer. What you saw now was a clip from an episode on our channel where we talk about the history of how humanity got to learn of diabetes. How do we come to know of the disease? How do we detect the illness? Which form of healthcare is the best at treating it? To watch it in detail, please come over to our YouTube channel where we list out relevant information. Please follow the link that will appear on your screen now. See you there.